I noticed that the color of the free malaria nets have changed. There was a time in Kilifi, and this is not a joke, there was a report that the Kilifi residents would get the white ones, and then they'd take to the tailor and then make wedding gowns out of it.
Yeah, the issue of bed nets, the shape and the color is an interesting one in this country.
In studio with me, we've got Dr. Willis Akwale, Senior Advisor to the ALMA, that's the African Leaders Malaria Alliance, which is an initiative of the African Union and in their quest to fight and bring an end to malaria. Dr. Akwale, good morning.
Good morning. Good morning to you, Nick.
Yes. Hope you're doing well.
I'm doing well this morning.
Yes. Just tell us about malaria generally before we get deep into the matter.
Yeah, so first, malaria is a very old disease, estimated to be about 3,800 to 4,000 years old.
Okay.
Believed to have started affecting man from the birds. So there are 4 types of malaria. You have Plasmodium, falciparum, Vivax, Ovale, and Malaria. That sounds strange, but I think the most important thing is many people think it's mosquitoes that cause malaria. No, it is that parasite, that one which is that old, is the parasite that causes malaria. The mosquitoes transmit the parasite to the human beings.
Okay.
So that is the very first basic I would want to point out. Then the other important basic that I want to say is there are different types of mosquitoes. Not all of them transmit malaria.
Okay.
We have something like very close to 400 types of mosquitoes.
Oh, 400?
Yes, different types. And about 80 of them have the potential to transmit malaria.
Okay.
Many of these are grouped into what you hear Anopheles mosquito.
Yes.
And specifically the female Anopheles is the one that will come and bite the human being and then pick up a blood meal that contains what we call the gametocytes that then go into the body of the mosquito. They develop into now another form of that parasite known as sporozoids. And now when the mosquito goes to bite the next person, it pours those sporozoids into the blood of the next person. And it's the sporozoids that then go to the liver. And that is where they now develop and cause the disease malaria.
All right. And you said there are 400 different types. Where are they predominantly found? Because you said out of 400, which I guess you know most of them, there's places where you'd find more of malaria-carrying mosquitoes, others. Yeah. Tell us the different kinds.
Okay, so in this country, the 2 types that really transmit, we call them Anopheles gambi, Anopheles funestas, that is the big family group, and another group called Anopheles arabiensis.
Yes.
Now, these ones are mainly in Western region, the former Nyanza province, the former Western province, the Coast province, and in between here, we also have low transmission areas that have these parasites like Kirinyaga and Central province.
Okay.
So that is where we get. Now, I know many people, whenever they see a mosquito, they think it's malaria.
Yes.
Here in Nairobi, the types of mosquitoes we have are not really Anopheles.
Okay.
So transmission doesn't happen. The type of mosquitoes we have here are mainly Culex. They almost look like a helicopter, big.
Oh, they're very big ones, eh? Those ones are found predominantly around in Maradaima. It's like their headquarters.
So they love where you call sewer lines, broken sewer lines, dirty water, heaps of rubbish.
Yes.
That's where they will grow and they will fly.
Thrive.
Yes.
Okay.
We also have another one known as Aedes.
Yes.
And now Aedes likes breeding and collected stones and heaps. You know, in Nairobi, there's a lot of construction.
Okay.
We don't have very good practices of disposing materials after construction.
Okay.
So you may find under those stones, heaps of stones, these mosquitoes will breed. They are used to, their proboscis or their mouth keeps hitting stones. Now, these ones, once they live there and they come and you people are sitting eating nyama choma in your neighborhood,
yes,
they bite you and you really feel like,
hey, you think you stepped on a needle. It's one strong mosquito.
Yes, yes.
Now, recently, you are in Kilifi for a project that's being run by the ALMA, the African Leaders Malaria Alliance. which is currently being chaired by President Uhuru Kenyatta. And this is an initiative of the African Unity Union. Maybe you can tell us briefly about the chairman and all he's doing within the ALMA in Africa.
No, thank you. For us, it was a great day. It was a very important day for Kenya and for the African continent. His Excellency President Uhuru Kenyatta is the current chair of the African Leaders Malaria Alliance, which brings all the 54 heads of state and government within the African Union together, and each of them has issued as a 2-year term. When they have a 2-year term, they spell out an agenda as to what they are going to do to ensure that the African continent is free of malaria by the year 2030. So they have a resolve that really by 2030, malaria should not be a major public health problem on the continent. So for His Excellency, therefore, the first one is digitalization. He wants to ensure that the data about malaria right from the grassroots is made available in a digital form so that people are able to visualize that.
Yes.
The other agenda he has is to do with mobilizing local resources so that as a continent we start fighting this malaria with our own. So he has called for the formation of what we call End Malaria Council and funds. And in it, he has really emphasized the need to move towards local manufacturing for the commodities that we use to fight malaria. The other one is engagement of the regional economic blocks. So this is the EAC, SADC, ECOWAS, so that they become the pillars. Remember, they are at a strategic position in terms of resource mobilization, engagement of other countries. Mosquitoes know no boundaries. So unless these economic blocks come together. And the final one, and that is what took us in Kilifi last week, is the putting the youth at the center of the war against malaria. Not only at the grassroots, but also both at national and at regional levels, in terms of advocacy, but also in terms of action.
So how are the youth engaged? They do pretty much all the work? Are they, you look for professionals or just people from that area?
So, you know, it's always said if you do the same thing over and over again, then you will get the same result.
Yes.
So the vision of His Excellency, the President, when it comes to the youth is twofold in this way. One, they need to be advocates. They need to put malaria as a priority, a socio-economic development agenda. They need to talk about it so that leaders own it and really take it as one of their priorities. Now, the other one is to have them involved so that you are staying in the village, the mosquitoes are ravaging you. Malaria mainly kills children and pregnant women.
Children below a certain age?
5 years of age, they are the most affected. 5
and below?
Yes, and in fact, maybe just because it kills children, we don't see it as a big public health problem. You know, adults feel COVID is ravaging us. You know, but in 1 year, COVID had only killed just over 2,800.
In Kenya?
In Kenya. But malaria, estimated 20,000. So 6 times
the
majority of this. And again, remember, children under 5 years in the villages, some of these deaths go unreported. So malaria remains a major killer that we need focus. So His Excellency's vision is the youth in these communities, a disease that is preventable and that can be treated. We definitely can do. So the energies of the youths is what his vision is, that we tap in and ensure that they are at the center of especially preventive aspects of the disease.
As you mentioned earlier, it's about 2,800 who have been affected by COVID. But now, as the COVID pandemic goes on and your fight against malaria, has there been any bottlenecks that have affected the fight? You know, because maintaining social distance, no public gatherings, is it hampering your efforts?
I must say, and that's a very good question. In the very beginning, we realized we expected that there would be an impact in 2 ways. One, as we are saying, health facilities had really been overwhelmed. People were not giving treatment. Services like key to malaria prevention, distribution of bed nets, ensuring people are promptly treated. Malaria is a disease that you must quickly treat once it's diagnosed because it's a killer. All these were getting affected, including how do you make a diagnosis using a rapid diagnostic test kit or microscope? So last year between March and April, and President Kenyatta took over the chairmanship actually 6th of March. And if you last year, and on 13th the first COVID case came. So among the very first thing he did was to rally the African presidents and some of our partners who produce malaria commodities, not to just focus on PPEs, because the continent was running short of even test kits, for example.
Yes.
And then everybody was now only trying to produce COVID test kits and not malaria test kits.
Yes.
And he rallied them, and actually we started getting some of those manufacturers focusing on malaria. But that then taught us a lesson that Africa must be self-reliant. We must produce these kits by ourselves. So that is why last week you may have noticed that he unveiled a locally produced malaria rapid test kit.
This is the first time that's being produced in Kenya.
Yes, he unveiled it. It's going now through the last stages, which is validation. And then we are going to look at, once it meets all the standards, it is approved, then how we market it, not only in Kenya but across the African continent. Because at that time we were depending on manufacturing from Asia, India and China in particular. Yes. And because of COVID, that was no longer their priority. So that was lesson number one, which we hope from that lesson we are going to become self-reliant.
So like this rapid test kits for malaria can only be done in a lab. You can't. What is a basic symptom for, let's say, the mama in the mashinani, or you've got a little baby, you're a single parent caregiver. I know a lot of people disregard the symptoms. Sema mtoto labda naumwa na kichwa, labda tu ni baridi. What is that one thing you have to look for to know that I must take this kit to the hospital?
Fever is what we call cardinal symptom number one.
Okay.
They run a fever. Nowadays, many mothers know that a fever is anything beyond 37.5 degrees centigrade.
Okay.
Because courtesy of COVID, people didn't even know what is this 37. Fever is one. Now, then there's lethargy. They are just sick looking. Then you find they are vomiting. You give them food. Many children, they'll be vomiting. Diarrhea will also be there. But more important to check the severe disease is loss of blood. So when you look below their eyes, it's supposed to be red, pink, but they become a little bit white. That means the malaria parasite has swallowed or eaten, destroyed the red blood cells in this child.
Now the ALMA being chaired by President Uhuru Kenyatta is a body that's covering the issues of malaria across the continent of Africa. There are some countries that don't have the resources, or they're having a bit of issues, in regards to safety. There's maybe some war here. What is ALMA doing to ensure that these far-flung areas are also benefiting?
Yeah, now let me say that a lot has been done. And I want to combine your question, including then what we did with the COVID last year, when after around 3 months, we realized if we don't do much, then the continent, in fact, WHO predicted a doubling of the number of cases of malaria and even the deaths.
Yes.
Fortunately, it did not happen. And part of the reason is there are many partners who support malaria programs on this continent. The Global Fund for AIDS, TB, and Malaria, particularly, is very supportive in procurement of bed nets and insecticides.
Yes.
We also have the U.S. President Malaria Initiative that also gives a lot of support to these interventions. So the first thing was to get the commodities.
Okay.
So bed net campaigns started across the continent. We many countries, after a lot of discussions, we realized we are able to still comply with the COVID rules of physical distancing. People are then called, you don't have to call them in crowds. And for sure, the African continent was able to distribute 200 million bed nets. Secondly, ALMA is about advocacy and engagement. I think the beauty about it, it brings the seriousness at the level of heads of state and government.
Yes.
So decisions are made at a level where once it is resolved, then the political leadership in those countries take that seriously. And for sure, malaria is one of the things the African heads of state have put as a priority. And that is why they are really now looking at local solutions towards this challenge.
As you have said, since our President Kenyatta took over the ALMA, maybe the statistics of how the impact of his presidency right there, has there been improvement? Has there been low infection, as the year proceeds? Can you say he's doing a good job?
Call it 15 months. His Excellency has been the chair. I think the 5 countries have now formed what we call End Malaria Council and funds, starting to raise local resources. He has launched what we call the Zero Malaria Starts With Me campaign, and here he did that in December, and all the governors, there's a big photo where they pledged that they will make it their priority within the counties.
Yes.
He has called for local manufacturing, and he's really pushing, and that's what I've talked about, the RDTs. And now you've seen the issue of the youth. But also more important is the fact that in digitalization, we now have a regional hub, a data where all countries report and share experiences. You report the data, it's analyzed. We know what is happening in West Africa, East and Central. I think, to me, that is some of the achievements, and they are definitely going with time to have an impact.
All right. So apparently, while in Kilifi, there was the launch of the spraying, anti-malarial larvicides. From the word larvicides, I can tell it's killing all the larvae. And there was use of drones in that area. So I'm guessing, obviously, you're moving away from using manual capabilities. How big of an area can a drone cover? And maybe you can expound further on that.
Now, let me say something about this initiative. Again, it arises from the decision to form End Malaria Council. So in Kenya, we formed our council in February of this year.
Yes.
And between just the last 3 or 4 months, it has been a lot of how do we raise resources. And they came up with this idea of public-private partnership.
Okay.
And because currently the Ministry of Health's focus is prevention, we appreciate bed nets are very important because the mosquitoes bite at night, as I've said, those that transmit malaria. But they breed somewhere. Why not go and attack them at that breeding site? And there we know that they will they'll become a larvae, they become a pupae, and then they'll fly off out of the water and start causing havoc. And they can fly up to 2 kilometers, 3 kilometers. And they can breed in very small ponds of water.
Yes.
In fact, the hoof of, let's say, a cow, or in Western and many areas, because people fear their cows will be stolen, they put cows very close to their homesteads.
Yes.
So that if somebody comes, they can hear what I say.
Who is attempting to.
So there will be those hoofs, footprints.
Yes.
And then there's usually the water settles. Anopheles tends to breed in fresh water. Not dirty water like the culex I told you about Nairobi.
Okay.
So once the water has settled in those footprints, they will breed and they can produce very many mosquitoes. A mosquito can lay up to 400 eggs.
Wow.
So you can imagine if each of those hatches, what havoc it can then cause in an area.
In like 10 footprints.
Yeah. So we realized there can be huge breeding sites. There can be small breeding sites. Now, these huge breeding sites, like in the Kano Plains, how do you reach there? So technology is there. So the Malaria Council then discussed with some private sector people who operate drones and said, Zanzibar has effectively used this to do larviciding. Why don't we try it in Kenya? And there are private sector players who are authorized to operate drones. And they said, all you need is you give us the larvicide that will spread and kill, and us will support you to do this. And we do a pilot, we demonstrate how it works, and then if it's a useful one and has an impact, why not scale it up? So the beauty about that innovation is also that these drones are able to map. So if you saw in Kilifi, one drone went up, it mapped and identified where the stagnant pools of water are. And then maps were produced, and these maps can show you the very big ones, and it can show you even small ones which are near homesteads.
Okay.
So then you target. And on that day, there was also the launch of the Youth Army. So the Youth Army went to spray the larvae side. next to homesteads, and also open those drains so that there are no stagnant pools of water.
Oh, the youth army is now like kazi kwa vijana. They go physically to the
yeah,
ground.
and I'll come back to that because it's also going to be a game changer in our home. Now, then the drone is able to fly up to 80 kilometers. The one we used that day, we were told it uses 3 batteries. Each battery is able to sustain it for 30 minutes, so you have 90 minutes of flying, and in those 90 minutes it can do 80 kilometers. But in terms of spraying, it can do 150 acres per day.
That's a huge...
So it's very, very huge.
Effective, huh? Nice. So now tell me more about the youth army. You said you're going to get back to that.
Yeah, so the youth army, which is quite one of the legacy programs for His Excellency the President, one of the things we looked at is how do we sustain them? How do we ensure they remain focused on malaria? And what he directed on that day is that they must be part of Kazi Mtaani. The Kazi Mtaani initiative, which is a government initiative of cleaning up estates and villages, and these youths are given a stipend to do that. I think it's under the Ministry of Housing.
Okay.
So he has directed that youths that are involved as part of the youth army, they will be part of Kazi Mtaani. So they'll be getting a stipend as they support malaria control initiatives at community level.
Why do I feel like Kenyan scientists are left out in all of this? Or are they part of the initiative, but now the bigger things are coming from outside?
It's an important question. I talked about the rapid kit, but that aside, what we are now doing, like our collaboration with Cuba, is actually a technical collaboration. We want to produce this larvicide here in Kenya.
Okay.
So there will be technological transfer in the process of that implementation.
That is Dr. Willis Akwale, Senior Advisor, ALMA. That is the African Leaders Malaria Alliance, an initiative of the AU. And just before you go, I noticed that the color of the free malaria nets have changed. There was a time in Kilifi, and this is not a joke, there was a report that the Kilifi residents would get the white ones, and then they'd take to the tailor and then make wedding gowns out of it.
Yeah, the issue of bed nets, the shape and the color is an interesting one in this country.
Yes.
And we've previously had to engage social scientists to understand the various areas. There are those who don't want white, because, for example, white is associated with the genies and other things. So they will prefer blue.
Okay.
But again, once you go there, there are those who don't like the rectangle ones. Looks like I've put somebody in a coffin. So they like the conical one. And then you go to Western Kenya, again you find very different perspective about that. They prefer white for some reason.
Yes. So it's been changing over the last few years. I thought it's because of the wedding gowns.